Hi everyone, welcome. We are so excited to have you all joining us this afternoon for our webinar about the program in Health Administration and Policy. We're very much hope everyone's having a great summer and very much looking forward to welcoming you here in just a little less than 2 months. And for some of you with advanced standing already here, hope you're having a great quarter. Quick round of introductions from the admissions. You probably know one, if not all of us, but I am Aaliyah McKessie. I use she, her pronouns, and I'm the Associate Director of Admissions here at the Crown Family School. And also joining us from the admissions team, Adam Smith and Kate Shim, who are Assistant Directors of Admission. So we'll be in the chat sharing, answering any questions that we can answer, or just gathering those questions for response after the Q&A portion of the presentation. Without further ado, I will turn it over to Laura Botwinick, who is the director of the GPHAP program, to talk all about it.
Hello, everyone. Welcome. It's so great to see all of you, and thanks for spending the morning with us to learn more about GPHAP. We pronounce it GPHAP. The PH sound is with an F, so GPHAP, Graduate Program in Health Administration and Policy. It is a certificate program housed in the Crown Family School, and it's actually been around since 1934. It's known as the oldest health administration program in the country, and it started at the business school here at University of Chicago. And in the early 1990s, it transferred over to the Crown Family School, which at that time was called the School of Social Service Administration. So it's been here since the early 1990s. And I've been with the program for quite a while, and I'll tell you a little bit about that. But the faculty director, Colleen Grogan, has been with it from the beginning. And you wouldn't know it from seeing her and working with her that she's been around that long. But she is a health policy expert, and she's passionate about health administration and policy, and she's been guiding the program for all those years. I've been around for 17 years, and healthcare is just such an interesting field to be in. You know, if you haven't explored it much lately, it's just a constantly changing field within the U.S. economy. So that's fascinating, and there are all kinds of jobs one can have in the healthcare field. And you all are, at the School of Social Service Administration and interested in mental health care, which is healthcare. And there's such great progress in meshing mental health care and physical health care in our healthcare ecosystem. So congratulations to you. And healthcare does make up nearly 20% of the U.S. economy in all its different mechanisms and forms. And so there are all kinds of jobs that people can have in the field of healthcare. I know some of you come into Crown thinking a lot about the clinical field and one-on-one therapy, and others of you may be coming to want to run some not-for-profit organizations or work in not-for-profits that are maybe not so clinical, and that's fine too. And even those of you who are working and have a mindset for being clinical and being in those therapy situations, it's just always great to know more about the system within which you're working. So congratulations to you in wanting to learn more about this. So I'm going to tell you about GPHAP, and I'm going to tell you about the application process and some deadlines, and then you can put some thought into whether you want to apply. GPHAP is a certificate program. It's not a standalone program, so participants need to finish their main degree, their master's degree, in order to earn the GPHAP certificate. Also, even if you've completed all the coursework and everything else, that doesn't get awarded until you've got your degree. because the idea is that you're building on the foundation of your coursework at Crown or at the other schools that participate in GFAP. And then you're getting this added healthcare expertise. GFAP is an interdisciplinary program, which is part of its secret sauce and its appeal. And that means that we bring in students from Crown and also from the business school, which they call the Booth School of Business, and the Harris School of Public Policy, the Law School, and the Pritzker School of Medicine. So there's 5 participating programs, and we occasionally have a student from the Divinity School in the program. We have a US track and a global health track. And the US track is the one that's been around forever. And the global health track is newish in the last 12 years or so. The global health track brings in fewer people because we're building it on the same level of endowments, and we didn't want to dilute our funds too much by just doubling the number of students in the program. And the global health track relates to global health in low and middle income countries. There's a lot of crossover between the 2 tracks, so I can talk about that as well. GFAP has kind of 3 buckets that you need to complete. It's the coursework, the practicum, and the co-curriculars. The coursework is composed of 4 courses, all of which count toward your degree. And I should say it doesn't cost you any more to participate in GFAP. It's included for those who get accepted to GFAP. The coursework involves 2 required courses and 2 health electives. And on the US track, the 2 required courses, the first one is a course in the US health system that you take in the spring quarter of your first year. And I'm talking about full-time master's students now. And the second required course is what we call the capstone class, and that is taken in your final quarter, so the spring quarter of your second year. And then the 2 health electives, you can choose from a list of approved health electives, and you can take them at any of the schools, and that's sometime encouraged so that you can get experience outside of Crown. And if you're on the US track, your health electives can relate to global health. And if you're on the global health track, your health electives can relate to US track. The first required course for the global health track is one that's called Global and Social Development, something like that. It's a foundational course in working in global settings. You may also have heard of the GPHAP program. That's another certificate program at GPHAP. And they are a global social development certificate program. And you'll need to choose one or the other. Like we can't even the first required course for both is the same course. So you could be with students from GPHAP, but we've just found it's too hard otherwise to coordinate a student being in both. So you would choose. The electives, the 2 health electives can also be a place where you can tailor GFAP to your interests. So you might be interested in women's health or solving health disparities or LGBTQ health or Asian health or in the Indian healthcare system. Or you might be interested in even housing and health or food security and how that relates to healthcare. So you can take an elective that relates to any of these areas to understand the impact on health. So those are the things that I would say about the courses. The practicum is can take many forms. It can be your Crown School field placement if it's not totally clinical, if it has administrative and policy components. It does not, your practicum does not have to be your field placement. So I tell students, um, you know, your field placement is something you're doing for the entire academic year, and spending lots and lots of time there. So do choose something that you really want to do for all that time. And maybe it'll count as the GFAP practicum. We could talk about it, you and me. But it doesn't have to be. There are other ways that you can fulfill the practicum. GFAP will offer um, about 10 to 12 research assistantships per year. So I line up 100-hour research assistantships or internships during the academic year with faculty all across the campus, not just at Crown. And that count, all of those, any one of those that we offer can be your GFAP practicum. Those require an interview process, and I give all the guidance for those timelines, and you would express your interest, and you send your resume, and the faculty who are running those research assistantships would decide who they want to interview. And then that comes with a stipend. This is a nice thing about GFAP is that our endowments and allow us to pay a stipend for the research assistantships and also for the summer fellowship programs that I'll tell you about. The summer fellowship programs I'll tell you about because I'll tell you about it now because they count also as the practicum. And what we have are the Erickson fellowships and the Quern fellowships. The Erickson fellowships are 10-week full-time summer internships at the medical center. And we line up a really interesting jobs, they're not jobs, they're learning experiences. So you're not uh, you're not filling out a time card or anything, but it is the stipend is paid based on full time for 10 weeks. And it is, like I said, a learning experience. And so you'll have a mentor who is guaranteed to give you not just busy work, but a good experience. And I'll do an information session on that and the Quern, which I'll mention. And so you'll know about what those opportunities are and what the process for applying is. So that process all starts in March, because that would be the summer between your first and second year. The Quern Fellowship is an independent project of your own design. It's also intended to be a 10-week full-time process. It can be done here in Chicago or elsewhere. And it's a two-step process where you do a letter of intent. We have funding for about 5 of those. And then you do a more detailed proposal if invited to, and you find a faculty mentor or a person who's in an organization that you're going to be working for. But this is of your own design. It's not an established internship that someone else is creating for you. And we like to see people working in Chicago with maybe Chicago not-for-profits, because you're actually researching something and building something while you're here that you can leave behind. And for the Erickson Fellowships, I think I said, we line up about 8 of those. So you have to apply for all of these. So it's not something that's guaranteed to you when you come to GFAP, but those are options, and those all pay stipends, and they all count as the practicum. There's also another fellowship that you can apply for as part of the application process, and it's called the Brown Fellowship. And that is not, it doesn't count as a practicum, but it comes with a $1,000 stipend, and you are like the person designated from your cohort of Crown students to work with the Brown Fellow from the other schools to create 3 events for the GFAP community. One the first one would be in the spring quarter of your first year, and then the second and third would be in the fall and winter quarters of your second year. And those events can be like a panel discussion, speaker. Sometimes we bring in alumni to speak. And those events count as GFAP co-curriculars, which I'll talk about next. But that's the Brown Fellowship, and it's a separate part of the application process that's optional. The stipend amount I told you for the Brown Fellowship is $1,000 and is paid in two portions, one in the spring quarter of your first year, and then the next one in your second year. The Erickson and Querns are stipends of $7,600, and the research assistantships are $1,800 stipends for first year students and $1,900 for second year students. So those are the fellowships. And then the third bucket are the co-curriculars, and those are going to healthcare related events, 3 per quarter if you're a full-time student. So that's 9 for the first academic year and another 9 for the second. So you end up with 18, and you do a write-up of 250 words for each one and upload them to the GFAP Canvas site. And those are an opportunity to get more healthcare content. And GFAP students really do say at the end of their experience that those were helpful. They look back at the list of all the things that they learned about, and they say that was really valuable. The reflections are to help you just deepen the knowledge that you heard at each of those events and integrate it with your other learning and identify questions and things you want to understand better. They're not being graded, but it's part of the GFAP process. So that's it. I will say we also have a GFAP weekly digest. So weekly we send out a list of a lot of the things going on around campus that are healthcare related, so that it's not hard for you to find those lectures to go to. And we'll list other things like do some student spotlights and sometime an alumni spotlight, and send reminders and things through the GFAP Weekly Digest. I'm just going to check my notes and make sure I've covered everything. We talked about the courses. Oh, I didn't tell you about the second required course. The second required course, coming back to you on Zoom, the second required course is a capstone course that has you working in interdisciplinary teams to solve a complex problem that's a real live problem in healthcare. So we identify leaders in organizations varying from the University of Chicago Medical Center, which we use a lot, to insurance companies, we worked with Illinois Medicaid. We've worked with federally qualified health centers. At the medical center, we've done projects related to AI in healthcare and worked with their urban health initiative on maternal health care, use of doulas, community health workers. We had a project on the new Medicaid requirements, work requirements, and how that's going to impact the healthcare field and patients, communities, policymakers, regulators. We had a case on climate change and health. I mean, a lot more students are getting interested in climate change and health, and it's important to be doing work around that. And more people at the university are working on that too. So if you have a focus in that, you can apply it in GFAP. And that's a taste of some of the things that might come up in the capstone class. So for the whole 9-10 weeks of the spring quarter, you are working with students from other schools. And that's the thing about GFAP, to just come back to the secret sauce being this interdisciplinary experience, is that everybody brings in the capstone class, everything they've learned, in their master's degree program, and their health content that they've gotten through their time in GFAP. And you share that as part of a team. So you share how your field, how your discipline would approach this problem. You'd hear about how a business student is thinking about it and how a policy student would think about it. And you'd understand, the different parts that everybody brings that need the different levers that need to be pulled to address complex problems. And then the task in that class is to integrate everyone's learning and ideas, um, using the tools that you've learned in your master's degree experience, and create a final report. And the report is a PowerPoint presentation that we call them the case mentors, that they get and that they can even use. So you've created something that hopefully is going to make a difference as well. And the case mentors now that we work with really find it helpful working with GPHAP students and um, getting that input from you all. So I'll go back to my list, and we'll take some of your questions too. We talked about the global health track, the co-curriculars. They can be lectures. They also can be, we have an occasional pub night. We might have an alumni student event. Those networking events can count as the co-curriculars also. They can be online learning experiences. There are tons of great lectures that are archived, so you can listen to those for your co-curriculars. And the practicum we talked about. If you're interested in global health care, there is a Center for Global Health that's that's connected to the KIPP Center. The KIPP is based in Crown. They also work with a Center for Global Health that's over at the Medical Center, and they have summer research fellowships that you can learn about, and those count as GPHAP practicum also. We talked about the fellowships, the Brown Fellowship, Quern, Erickson, the research assistantships. We have a little bit of funding for low and unpaid summer internships that you might get on your own. You can, for the practicum, you can get that experience on your own. It doesn't have to be, the practicum doesn't have to be one of the things that we line up or your field placement. It could even be something you find on your own for the summer. Just run it by, the GPHAP director, run it by me, and we can make sure that that's going to count. Communications, talked about the newsletter, which we call the Weekly Digest. We have a Canvas site for GPHAP students where we'll keep some of our key documents, and that's where you will upload your co-curricular write-ups. We have our listservs. There's often a WhatsApp group that students use to coordinate going to things together. Case competitions are becoming more popular, so GPHAP students will sometimes reach out to put together teams to compete in those, and those kind of things can count as GPHAP co-curriculars. We have a Facebook group and a LinkedIn group for GPHAP alumni and current students. We have our website, which you probably have all seen, and we have our logo, which is on our website, which has the maroon wave with the 5 loops there, and that represents I'm coming back to you now from my notes. That represents the 5 schools that participate in GPHAP and teamwork and interdisciplinary studies. So that's what you see in our logo. So that's it in a nutshell. The application process is the last thing I'll talk about, and then take your questions. The application due date is the day after Labor Day. So this year that's September 8th. And it's a personal essay in response to our question that relates to why you're interested in GPHAP and what your background is. And you can read that question. And then you also submit your resume and fill out the application form itself with your details, name, so forth. And that's it. That's it. And then if you are interested in the Brown Fellowship, that's an additional short essay on leadership, other leadership roles that you've had. in addition to putting together those programs, that the 3 events that I mentioned. But the Brown Fellow would be the first person that I would reach out to kind of say, what, I'm thinking about doing a pub night on this night. Do you think that would be good for the other Crown students, or do you think that'd be good for the other Harris students? Or, just kind of be the person I would go to first. And the application process. We bring in about 10 students from each of the schools, and for the US track, and then for the global health track, about 4 students on the US on the global health track, because it's smaller, and we, like I said, we don't want to dilute our endowment reserves too much with all the stipends and things that we pay out. And Colleen and I review those applications. We're the review committee. And so we are able to get back to people as to whether they've been accepted within, by the end of September, you would know. And then we have an orientation session for everyone. So that's when you all come together. And so your GFAP experience starts right at the beginning of the fall quarter, when you can start doing your co-curriculars. And even the reason why the first required course isn't until the spring quarter is because Crown and Harris students generally are taking core required courses in their fall and winter quarters of their first year. And the first time you can really take electives is the spring quarter. I thought of one more thing to say, and this is something maybe the Crown staff could talk more about, but you guys have the opportunity to choose pathways at Crown, and the pathway that works most easily with GFAP is that pathway on integrated health and mental health. And that's because, as I understand it, required courses, or on the list for things that you could take for that pathway, are consistent with the at least the first required course for GFAP. So you're kind of killing 2 birds with 1 stone. But that doesn't mean that the other pathways are impossible. It's just, and some of them are impossible, and where you can't fit everything in, but it's not necessary that you take that integrated health and mental health pathway and be in GFAP. So with that, I'll see, maybe Aaliyah can kind of field those questions.
Yeah, for sure. We can start with Ron since his hand is raised, and then we'll go to some of the written ones.
Yeah, thank you. And thank you, Laura. Hi, I'm Ron Steffens. I'm a current advanced standing Crown student. I have a bachelor's in social work from Royal University. I run a nonprofit called Veterans for Community Empowerment. One arm of that does social emotional learning inside of communities like Oakley Square Apartments on the west side. And the other arm of that is community organizing. It's in the infant steps, but I want to take it in the direction of full community organizing, and wanted to see how this intersects with that, and how can I use this for what I'm trying to do. I know that's very vague, but the social emotional learning is an Excel program that has been around in the neighborhood for a very long time, and Veterans for Community Empowerment is taking it over. And the concept there is, we don't really go out and help veterans. We will, but we go into the worst communities and provide support, social emotional learning, and gun violence prevention, just mentorship with a network of good people that we've acquired, veterans specifically. Doesn't have to be veterans, but that's the idea. I think we have a lot of good skills. So when I seen this, it really appealed to me. But when I think about health, I think about hospitals. I personally don't want to be a clinician, but I think that's a big value in this nonprofit. So my question to you is, one, with all that, do you think this would be a good fit? Is there an intersection between the gun violence epidemic that I can kind of resource from this program, and maybe take some things away with the social emotional learning and the Excel program?
Yeah, yeah. Um, you can explore those interests in GFAP. Um, the gun violence issue specifically can be explored at University of Chicago Medicine. They have a really great program on it's a wraparound program and it's a violence recovery program. That's what they call it, violence recovery program. And it started in the trauma center and it with all the seeing the incredible harms to the victims and families of gun violence and how it's impacting them. So it's a part of the healthcare system.
Yeah.
And as and I would say to you, like as long as I mean, the first required course would be the U.S. healthcare system. And if it interests you to understand that better, then you know, um, you would gain something from GFAP. Um, Veterans health is certainly one of the segments. When I was listing different segments, I didn't say veterans health, but that's what your kind of space is that you're working in. So I think it's totally relevant. You mentioned that you're an advanced standing student.
Yeah.
That's you're at Crown for just 1 year, so we're still in a pilot process with understanding how it works for advanced standing students, but you would have to take the first required course and the capstone class at the same time because you're only going to be here for one spring quarter. So you need to think carefully about all the things that you want to take at Crown and whether you really can, whether you really do want um, to take the courses that are required for GFAP, because I
Yeah.
know there'll be lots of things that you'll be really interested in doing.
Sure.
When I listed the health electives, we can be, we can, I'll send out a list of approved health electives.
Yeah.
I wouldn't necessarily put a community organizing course on that list, but students in GFAP can petition me, as to whether a course could count. And so if you were going to a course like that, if they say there was going to be a final paper that counted for 40 or 50% of the grade, and you were going to somehow relate it to health care, veterans health, it could count as a health elective.
Makes sense.
But yeah, look at all the whole array of courses that are available to you and what you want to get out of Crown, and then you can make your decision as to whether you would want to participate in GFAP.
Yeah, thank you.
Great, and that was actually the next question was about advanced standing students taking both classes, so that's perfect. The next question is about part-time students. What does that course schedule potentially look like for part-time students?
Okay, yeah, good. And I'll add to the commentary about the advanced standing students taking both at the same time, both the first and the second. And we're trying that out for advanced standing students because we understand that they have come from, like Ron did, a social work bachelor's degree, that those students have and may even have experience in the healthcare field. So we're making the assessment that they're going to be they're going to come in with some knowledge that they can apply in that capstone class. So that we definitely sometime get a question from a 2-year student, can I take them both in the same year? And the answer is no. The GFAP sequencing is organized so that you take the intro class in your first year and then you're applying everything you've learned to that capstone class. Regarding the part-time student experience, we just spread all the GFAP requirement out over the 3 years. So that's how it works for you. So you don't have to keep up that pace of 3 co-curriculars per quarter, because I think sometimes maybe you're taking 2 classes per quarter. You can divide up the 18 over 3 years, so you can do 6 per year. You just have to be sure that you're going to be here for 2 spring quarters. And so a part-time student is strongly advised to take the first year course in your first year and the capstone class in your second year. Because I have seen part-time students who finish up maybe in the winter quarter of their third year, and then you've missed the chance to take the capstone. And we don't want a student to have done everything except that capstone, and then you don't get the GFAP certificate.
Great, thank you. The next question is a little more specific. So, would you recommend this program to a student who is interested in one-on-one therapy and potentially medical school in the future for psychiatry?
We find that you may know that at Crown they used to have like a clinical track and an admin track, which they don't have anymore. But a student who meets the profile that you just described might have been on the clinical track, and those students did very well in GFAP. And so it absolutely works. And you may just, I mean, because of what I said at the start, that you maybe really would benefit from understanding the system within which you're working. You can, and you may not always want to, you may not want to be on the clinical track forever. You may want, after you do that, you may want to take some leadership roles in healthcare organizations and do a little bit of therapy work, but GFAP could set you up to have that broader set of experiences on your resume. But it may be more difficult for a student who's really interested in that one-on-one therapy to give up some of your electives for for a health administration and policy kind of content. Because you might be like, oh, I just want to take, one more course on something really super clinical. And so that's that's where the difficulty might come in. With all Crown students have to be really careful with the planning for your courses and think ahead and really think about what you're going to be taking to meet all those Crown requirements. And then you just add in the GFAP requirements also. But that's what the Crown staff are there to help you do.
Yes, I was going to say, and we do actually have Jasmine on this call. I know you're not going to make you talk, but
Oh, hi,
one of our
Jasmine.
wonderful
Good. Oh,
academic
good.
advisors. So
Good, good.
if you have any specific questions about, kind of that piece, because I think, the key is making sure while we don't have the clinical track, students are still wanting to get licensed as a clinical social worker. So that's a little bit on you to make sure you have, what state you want to be licensed in. You're going to fulfill the requirements there. And then what else can you add to that? And that is that GFAP or is that other things. So
Yeah.
that's
There's something I wanted to mention about our first year course on the US track, and it's the US Health System course. And the professor who would teach that is going to be on leave. She's got a fellowship in, abroad next year. So we're still confirming who's going to teach that course. And so there is a potential. I just want all of you who would be taking that course, that that we may, just for this first year, identify some alternative health related courses that you would take in place of that if we don't confirm an instructor who's going to do the job that we need him to do.
Is the next question, is if there's a way that they can speak with current students participating in GFAP?
Yeah, you can email me and I can put you in touch with some of them, or however you want to do it. Aaliyah, you can.
No, that's perfect. Yeah, because
Okay.
I don't think any of our student ambassadors are, so the best way is definitely through you.
Okay.
And then the last question, at least that we have right now, and this may be something you know, maybe something you don't, but do you know of any of the pathways at Crown that don't align with GFAP?
The one that I know is the school social work one.
Okay.
That has a lot of requirements for additional.
Yeah, it's similar to KIPART, in the requirement, like the strict requirements. And schools is a subset of the children and family and systems context pathway. So theoretically, they could still do children and family and do GFAP, just not specifically schools, correct?
Yeah, that sounds
Yeah.
right.
Okay.
Though to know for sure, you just need to look at the
Mhm.
requirements. Yeah.
Yes. Yeah. Perfect. And Adam just sent Laura's email, so if you want to get in touch with her about students or just general questions, feel free to do that. That is all the questions that are in the chat. Unless anyone has any they want to come off mute for, we're happy to answer those as well. Yeah. Oh,
Hello, my name is Brianna Bolton. I am coming in with a psychology undergrad from Alabama State University, which is at HBCU. And I'll be coming in as well as a full-time Crown student. And similar to my fellow cohort member, I'm also not interested in the clinical side in regards to one-on-one. So I'm actually interested in the more macro and, violence prevention, trauma, and kind of being a gap filler for systems that exist within health institutions abroad and domestic. And so my question that I want to ask is, are there current, global health projects or projects or opportunities within the track that would allow a Crown student to study an effective model abroad and then adapt it responsibly for underserved, U.S. communities without simply copying it out of context, if that makes sense? Because that's kind of what I'm interested in, and I want to make sure I'm aligned. I don't want to waste a spot.
Yeah. Absolutely. That's great to do. Sounds like you're probably interested in a US track because you're going to be working in the US when you're done. Is that right? I mean, what I hear you saying is like, hey, let's look out there and see what other healthcare systems there are that are doing a great job and what can we learn from them and apply to our current healthcare system. So yes. So I think you would want to be on the US track so that you could really take that US health systems course and understand the flaws and the benefits and how it works so that you can then look outside to understand how to improve our current system. And many courses that you take, some, there might be a assignment for a final paper where you can choose the topic that you want. And then you could say, I'm going to look at 3 countries and their healthcare systems and compare and contrast. You can do that. One of the capstone class cases this past year was on the Cuban healthcare system and what's going on in Cuba. And that, of course, was a good one for a global health track student. I should say that the global health track students and the US track students take the same capstone class. So you're all together. And you might enjoy being on a team that's exploring what's going on in Cuba right now. You might, and have found that interesting. It's not a guarantee that something like that same case would happen when you're taking the class, but we've done courses, cases related to Haiti, Cameroon. The case in Cameroon was about health in in the midst of wartime situations. So does that answer your question? There may sometime there are even like comparative health system classes. There
Yeah.
hasn't been one in a while, but
Yeah.
that would certainly count as a health elective.
Yeah. Well, thank you. That did answer the question, and it kind of caveats into the next one.
Yeah.
Do you, because I'm hearing cases, and so do you go to these places? What does that look like? Yeah.
Yeah. No, you don't go. I suppose you could plan a trip as the team, but it's not part of no, we don't have, there's a lot to do in that capstone class because the quarters are really short, they're 9 or 10 weeks and there's a lot to do in that time. And so the capstone class is sequenced so that the first week you're getting introduced to the syllabus and how it's going to work. The second week, you meet with your case client. By the third week, your team has a plan for how you're going to approach the work for the rest of the quarter. You're identifying the population at issue. There's a strong strand of health equity through that course and throughout all of GFAP. And so how are the different segments of the population impacted by this health issue? And what are some potential approaches that you're considering? That's all week 3. Week 4, we're having you do some reflection on the teamwork and how the team is functioning so that you can shore up and make sure. So there's a focus also on effective teamwork and how, is there a space for everybody from all the schools to be expressing and sharing? And then by week 5, we're starting with some report outs to an expert panel that we put together that's related to, with experts that relate to your case and your case client. So it moves fast.
Well, thank you.
Sure. All right. Well, I'm very available to answer questions, and really look forward to seeing applications and learning more about you all.
Yeah, it looks like we have another hand up from Mark.
Yeah. I had a quick question. I understand. Do we have a campus in China, and also will we be able to study abroad in China? For I believe was it the winters? I know it's like the winter trimester or something like that in December.
Yeah, so we the Winter Institute is it's not a class or a specific kind of like term, but it is a travel experience where you go to Hong Kong and Vietnam, I believe, and learn kind of cross culturally with a class in from Hong Kong. There's a professor that travels with you from the U.S. and you get to travel, do some classwork, and also learn in different like kind of not field placements, but visits to sites that are similar. So that is an option that's open to any student. You don't have to be a part of any specific certificate or program besides being a part of Crown. And so that would be something you'd apply for, usually kind of coming up here in the fall for the December travel.
Okay, thank you.
Yeah, of course. And then it looks like there's some questions in the chat, some last minute ones. So if a student realizes they're not suited for the GFAP program after joining, would there be an option to leave? Oh, you're muted, Laura.
There's no contract or commitment to continue, but I really, really hope that a student that applies has thought it through and feels like this is a program for you, because if we do accept you into the program, it means that we've not accepted someone else. And so you have, and so we don't want to end up in that kind of situation. That would just be sad that as another student wouldn't have the opportunity to be in GFAP, but also we don't like to see people dropping, because by the time we get to the capstone class, we still want to have that balanced enrollment in GFAP so that we could put together teams that have membership from all the schools. I hope that helps, but you certainly are, can drop.
Great. And then there's a question about can they apply for both the US and global?
You can. I would ask that you express which one you want, and if you are applying for either, then you can explain, your interest in both. But it'll become pretty clear from your resume and your essay, which one is the most appropriate for you? I'll say also, there are a lot of you who are here on this informational call, which is so nice, and really appreciate your interest. If it comes down to us having to make decisions about who is going to get those slots, we will start to consider how much previous work you've maybe done in this broader field of healthcare as I've described it. It doesn't have to be, it's not all about hospitals and clinics. It's about doing work in this broader area. But we do want to bring in people who have a demonstrated interest and work in this area when it comes down to making difficult choices, because it does mean then that you're less likely to drop. I mean, in all honesty, it means that you've got a demonstrated interest in this area.
Great. And then there's another question about who someone could speak to if this program would be a good fit. I would say definitely reach out to Laura if there's questions. Yeah, that's probably the best as far as if this program specifically would be a good
And
fit.
if you have, given what I just said, I mean, if you have questions about, is my work and interest in this specific area consistent with what GPHAP's looking for? I mean, do what I think it was Mark or Ryan or the Veterans Health Organization person. I mean, because we really are open to all these different ways of doing work to improve health and wellness.
Great. Any final, you have just a few more minutes. If there's nothing else, you can give me back a little time.
I have a question that I feel like was kind of answered, but just more clarification is always better. So I am interested in working with adoptees and their families, and one of the issues that we face is a lack of medical history entirely. There's not very much information about how adoption affects people. So to broaden this, I feel like in connection to this program, it's one of those things where it's adjacent or not adjacent. It includes things that I think the GFAP program would benefit, but it is not directly related. It is not aligned with in a I want to say equal sense. That I don't know if that's the right verbiage, but is this still a good program? Or because I think she made a very good point. I don't want to be somebody who takes a spot and then that could have been much more beneficial for somebody else. But I do think it could be beneficial in adding to my education towards what it is that I want to do. I don't know if this, yeah.
Yeah. I would say if the program appeals to you right now, because of the learning opportunities, and I would say yes, it's for you. I mean, I'm thinking about the adoptees and the lack of medical history. I mean, that's a big problem to be solved, and it relates to medicine and health and policy, and an important element of society, adoptees. And so I could see that you would be taking the U.S. healthcare system course. I guess it's something I'd have to put some thought into, but what would your health electives be? You might have to do some more petitioning for a certain course to count. I'm not sure what more to say, except that if you feel like this program as described is exciting and would add to your Crown School experience in a deep way, then yeah, apply.
Fantastic. Thank you so much.
And the website does have some really good information about the actual, like the specific courses and things. So I think kind of as to Laura, what Laura was saying, if it's exciting, like go to that, see if there are classes that are automatically like, oh, I definitely want to take that anyway, because it is, you can take some of these classes without being in GFAP either. So just kind of it's the
Right.
extra requirements and the other things. But I do think the website does a really job of breaking some of those things down. So that might help to, if you're still kind of unsure after this, just to gives a little bit more specific context. And then again, can definitely ask questions to Laura, to us. We're happy to help.
Thank you.
Of course. Great, just making sure.
The difference between this program
Yeah.
and KIPHART,
Yes.
and if it would help me with being a transplant evaluator in multiple states. Well, the difference between like KIPHART KIPHART is a global program, and they have a parallel track and an immersive track. The immersive track, you'd have to learn more about. I think they go abroad for 6 months. The parallel track has more stuff happening here. You could talk to Aaliyah or some of the other folks to learn more about KIPHART. And then the question about helping you be an evaluator in multiple states, that sounds like a question for them also.
Yeah, I don't know what that specific role is, so you'd have to look into that. If it's the requirements of licensure in California, like just general social work licensure, this program doesn't guarantee the licensure courses. Those are separate. These would be part of your other curriculum. So schedule a call with us or with advising, but I'm not sure what requirement.
Okay. No, that's fine. I can ask, I can set up time outside to ask that question. It's really just, I mean, the goal for me was to do kind of be a private practice therapist and then also help with like liver transplant evaluations and helping on that side with the social work aspects. I know
Okay.
from looking at other programs, like getting an LCSW here versus New York versus like California have a little bit different rules. So I'm just like curious about who could guide through that, and making sure that if I wanted to go to California after the program, I could meet those requirements, or if I could get the right coursework, since there's, at least from what I've seen, there's some clinical specific classes that are needed, but that might be a little different than this.
Yes, yeah. So those would be your level of practice courses, and those would be something that we can definitely help with once you're in the program, but you'd also want to make sure you're keeping track of.
Yep.
So yeah, but those would be separate. That would, yeah, they might have some classes that count for both, but you can't, it wouldn't be like a guarantee with any of the certificate programs. So wonderful. We are at 1 o'clock, so I do want to be respectful of everyone's time. Thank you all for joining. Thank you, Laura, so much for sharing everything today. Please, like we've mentioned many times, reach out if you have any questions. Laura is definitely the great first step. If it's anything else that was talked about today, you can also definitely reach out to admissions, and we're happy to help. Have a wonderful rest of your day, and we look forward to seeing you on campus very soon.
Bye.